Hello, hello, and welcome back to another episode of the Stoddscast. I'm your host, Christine Cernelia, otherwise known as Stodds, and today we are going to go into a foundational episode that really helps set the foundation for everything that I'm going to be talking about on this podcast as we go forward. There will be a lot of health related content, and that's why it's important for you to know kind of my health story because there is a lot at play here. It is a long story, so buckle up, grab your beverages, and just get ready to hear it. I'm going to try to keep it light on the details that don't matter as much and then just go deep on the things that have been absolutely crazy. So let me start off by saying if you're here, you probably know I am a personal trainer and nutritionist. I have taken my health seriously for a very long time. I've always been into exercise and like all things health and fitness related. So when a few years ago things started to really go south with my health, it was very, very unexpected for me, and I did not know how to handle it. Was very confused about what was going on. I went from almost never setting foot in a doctor's office to essentially like living at appointments for a few years. And it has been a really hard, really informative, really eye-opening journey. And I want to share how it went with all of you so that when I can reference things later on in this podcast, you'll know what I'm talking about. Let me also say I do hope that the entire podcast series is not going to be about illness and health and chronic illness, but there is a good portion of it that's going to be because it has taken up so much of my life over the last few years. So, with that all said, let's get into it. My beverage today is an element electrolyte drink because I have POTS, which spoiler alert, you're going to hear about that in this episode. I have to ingest a good amount of sodium and electrolytes in general every day, and this helps me do that. It is not sponsored. It is just one of the many electrolyte brands that I like and use because since I have to drink so much of them, I need a lot of variety. All right, here we go. My health story starts in December 2021. If you have heard from me about my health in the last few years, I usually start telling the story from December 2024 because that is when things got absolutely insane for me. But if I really reflect, December 2021 was when things got weird. And not to, you know, show you things before we get there, but the only thing that I had done differently right before December 2021 was in November 2021, I got the Moderna booster. So spoiler alert, I am tying some of the health issues that I'm having to that, even if they weren't immediate. So, all that to say, December 2021, I start to experience heart palpitations and I start to kind of freak out about these heart palpitations. I I felt like I had had them before. I've had heart palpitations on and off my entire life, but like I'm talking, I would get one and then a few years later, I would get another one and be like, oh, what was that? It felt like my heart kind of skipped a beat. This was not that. I was having much more frequent heart palpitations and I don't know, like I have a kid now, like it's just really freaking me out. I had my first kid in 2020 and I don't know, I was just like, what's going on? Why do I have heart palpitations? So I went to the emergency room. They did nothing for me and said, hey, everything's fine. You probably just have anxiety. Another classic theme. So the heart palpitations continue. I finally catch one on an ECG on my Apple Watch and I am able to figure out that it is a PVC. I bring it to a cardiologist. They tell me it's a PVC, say they're normal, they're benign, everyone has PVCs, don't worry about it. Okay, I'm still kind of worried about it, but you're clearing me, you're saying things are good. That's good. And this time I also see a functional doctor. They don't really have any good answers for me as to why I am having heart palpitations, and I had just generally a really, really bad experience with that functional doctor, and I did not go back. So I was starting my route of trying to figure out what is going on with me. I'm not getting what I need out of the functional world, and I'm getting a lot of you just have anxiety and everything's fine out of the like traditional medical establishment. So this again is a recurring theme throughout the entire story. All that to say, since both sides of the world are telling me that everything's fine, I'm like, okay, then I'm going to clear myself to get pregnant again. I want to have a second kid. Let's give it a shot. And in April 2022, I conceive again. Then in May 2022, I'm in my first trimester and I get COVID for the first time. It was a pretty rough bout of COVID in the sense that like I had a high fever and the fever went in and out for many days. That was my first experience of a fever really going in and out. Usually if once I would break a fever growing up, the fever would be gone. So it was interesting to me that it just kept coming back. Part of the issue that I had here too is since I was pregnant, I could only take Tylenol, and Tylenol just straight up does not work for me when it comes to fevers. I don't know about you. I know a lot of people use it as their first line treatment for fevers. It just does not reduce a fever for me. It does not reduce the fever for my kids. It does not reduce the fever for my father. So it's just a thing. I remember calling the doctor and being like, "Hey, I have a fever in my first trimester. You are not supposed to have fevers in your first trimester. What is the better option? Keep taking Tylenol and know that I'm going to continue having a fever? Or like, what if I do just take acetaminophen or take ibuprofen, knowing that ibuprofen will knock the fever down?" And they were like, absolutely do not take ibuprofen. Keep going with the Tylenol. So I kept going and felt like dog shit. Already felt like dog shit because I do not handle the first trimester well of pregnancy anyway. But I got through it. It's not like I had like lung issues or any of the scary stuff that people were talking about with COVID. So like ultimately moved through it and was like, okay, whatever. Then we get to December and I am 35 weeks pregnant and I get a high blood pressure reading. So high was 120 over 90. My blood pressure at the appointment before that, I think, was 102 over 60. So it was quite a jump. And they took one look and said, we need to monitor you a lot more closely because of how high this blood pressure is. And I'm like, okay, 120 over 90, it's really not that bad, but whatever. Um, they started bringing me in on a much more frequent basis just to check on my vitals. And everything was looking good from like a preeclampsia standpoint, but my blood pressure did keep going up with every appointment. I was going for a VBAC. I had an unexpected C-section with my first child, and I really wanted an unmedicated um, birth for my second child. I really had wanted that for my first two, but I was like, no, 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 this is my chance. I know I'm not having more kids. I need that VBAC. And so I was really fighting the induction, but I hit a point where my OB said to me, if you were my relative, like I would recommend that you go get induced right now. And that was at 38 weeks. I was a little over 38 weeks. So I was technically like full term. My blood pressure was high at the time. It was like 150 over 100, which feels insane to say, but it's not uncommon in pregnancy. So anyway, they sent me, I got induced, had the VBAC, lovely, beautiful birth. Some chaos. I mean, they were trying to like guilt me into a repeat C-section and I did not take it, but ultimately, had a pretty quick delivery and everything and felt great about it. And I was like, cool. I just did the thing that they told me was going to be the cure for this. I delivered my baby. Now I won't have high blood pressure anymore. Wrong. Not everyone who delivers gets rid of their high blood pressure. And not everyone gets through delivery and into postpartum without getting high blood pressure. Like you can have no high blood pressure your entire pregnancy and then it will spike postpartum, which was something I didn't know. So I was sent home, the normal 2 days after delivering, and then my blood pressure went up again, which I only knew because I felt like absolute dog shit. So I delivered Aria on December 20th, 2022, and I was home December 23rd, and then December 25th, Christmas Day, was when I was like having a glass of champagne and reading a book, and I was like, I just cannot read this book. Like, I feel like my vision is not what I'm expecting it to be. I don't feel good. I'm going to take my blood pressure. And it was high. So I called and they were like, you know what? Just, wait until everyone's back in office. Come see your provider. No, didn't work out that way because Christmas Day observed was going to be on a Monday. And so I think it was a Saturday at this point. So I was going to have to wait through this Saturday where I'm calling you feeling like shit, wait through Sunday, wait through Monday, and be seen Tuesday. And I was like, absolutely not. I just feel horrible. Let me just go to the hospital real quick, see if they'll like give me some medication or something, and then I can go home. So I go to the hospital and they readmit me and they monitor me and keep me for 5 days. During that course of action, they are changing my blood pressure medication over and over again, trying to get my blood pressure to respond. Horrible, horrible scenario. Worst 5 days of my life. And it was really hard because they would come in and take my blood pressure 3 times a day. And I don't know if you know anything about blood pressure, but when you are anxious, it will go up. And nothing like them only checking on it 3 times a day, knowing that you can't go home unless your blood pressure is a good reading to make you real anxious and then spike that blood pressure every single time. I'm not saying that was the only thing, but I'm saying it definitely was not helping my blood pressure numbers. And so then when they finally let me go home, I was on kind of a lot of medication, and I woke up after one night of sleeping in my own bed, and I was like, huh, I feel like I'm gonna pass out. I called, and I was like, hey, I just took my blood pressure. It's 80 over 50. What am I supposed to do? And they're like, you better put your feet up and take it again, because if it stays 80 over 50, you have to come back to the hospital. And I was like, get out of town. I'm not coming back to the hospital. So luckily, put my feet up, got a better blood pressure reading, and just had to wait it out, and then cut my medication way down after that. And then that's kind of started my weaning journey of getting off of high blood pressure medication, which was interesting because I started seeing a cardiologist, because at the 6 week mark, your OB kind of is like, I'm done with you. Everything's fine. Or like you just have high blood pressure now. That's your thing. Most people don't resolve it by 6 weeks. Some people do, but lots of people it takes a little longer, especially if you're like me and you get my fun sensitive to medication label that I now have, which basically meant that every time they would try to like pull me off of medication, I would rebound a little bit, or I just could not come off medication at the rate that they wanted to offer me. Like they would take me off of like 100 milligrams at a time of labetalol, and I could not handle that. I needed to cut by like 25 milligrams at a time. So I had to do a really slow taper. I go to see a cardiologist. She's like, girl, you might just be on blood pressure medication for the rest of your life. And I was like, I do not think so. She's like, is it genetic? Anyone in your family have high blood pressure? And I was like, yeah, the people who do not take care of themselves do have high blood pressure, but that the sample size of people who take care of themselves is too small for me to be able to tell you if this is genetic or not. So all I'm going to say is I do not think I'm going to have high blood pressure for life. I'm going to keep weaning off of this. And I did. And she saw me do it, and like obviously everything went fine. I came off blood pressure medication and was like, cool, I'm going to try and put this behind me. But I just kept feeling like something was not right. I still did not feel well. My blood pressure was normalized for the most part, but I would feel like lightheaded when I would stand up. I was getting shortness of breath. I couldn't make it up a flight of stairs without feeling like very icky. And my runs were not the same. Like I just could not get any faster in my running. I couldn't hit paces that I used to hit. My workouts weren't feeling super great. I was doing them, but I would get like sometimes heart palpitations during my workouts. And I was like, I don't know, something's not right, and the heart palpitations just in general were continuing. I started having panic attacks, which could be from the trauma of the rehospitalization, but it was a lot. Like I would just be getting them at night, and horrible experience. I had ear fullness, which I kept being like, oh my God, what if I have high blood pressure like in my head or something like that? Um, but then I ended up seeing so many specialists through this time, and they finally were like, you probably have reflux. And I started taking pantoprazole. That helped that. Um, but just in general, I was like, I don't feel good. Something's not right. The big things were like all the symptoms I just described to you, plus like the reflux. And, I have gotten multiple heart imaging things done at this point. They're like, your heart is fine. It's not something cardiac. I'm like, okay. I finally get a GI endoscopy from going on pantoprazole and being like, okay, it's helping, but it's kind of taking a while. And why do I have reflux in the first place? This doesn't make any sense. I don't have any of the risk factors for reflux. My endoscopy comes back normal. I'm like, okay. I go to my primary care physician at one point because I was feeling funky when I was standing up, and I was still monitoring my blood pressure really aggressively because of everything that had happened. So I took my blood pressure seated and then I took it standing, and I was like, that's weird. My blood pressure goes up when I stand. Everything you read says your blood pressure is supposed to go down when you stand. So I'm like, okay, that's weird. I tell my primary, I go in, and she's like, doesn't show me any of the numbers, but they test me seated, lying, and standing. And she goes, none of these are numbers that I would medicate someone for. I think you just have anxiety. So at this point, I've got my cardiologist who has said to me, you don't have any heart problems. You wouldn't look like you do if you have heart problems. Okay, great. You got my primary care doctor who's like, there's nothing wrong that I'm finding. I see people a lot sicker than you every single day. I think you need to stop worrying. I think you just have anxiety. I get the GI endoscopy, and they're like, I don't know why you have reflux, like, but everything looks fine. And I'm in therapy, and my therapist is like, I think you just have a lot of anxiety. And I'm like, okay, I just have anxiety. That's what it is. At this point, I'm like such a wreck that I agree. I will just go on anxiety medication. So in July 2023, I started taking sertraline. They prescribed me, they wanted me to get up to 50 milligrams a day of sertraline, but they prescribed me 25 milligrams to start. So I take 25 milligrams of sertraline, and I had so many heart palpitations that I went to the emergency room because I was like, okay, here I am, you know, taking this because I have anxiety that's causing heart palpitations. Well, I take a dose of anxiety medication and it gives me worse heart palpitations. What am I supposed to do now? So they're like, okay, maybe 25 milligrams was just a little too much for you. We're going to put you on 12 and a half milligrams and then you can work your way up. Well, I take the 12 and a half milligrams and I do feel better at that. So I ended up continuing to take that and just staying that. My panic attacks went away. Some of the noise of like, I'm going to die at all moments, very fun thought to be having all the time, went away. And so in general, it was somewhat helping. But I wasn't completely better and I still wanted to know, why am I having these heart palpitations? I don't want to just live like this for the rest of my life. So I still am on my journey of like, let's dig deeper. Let's figure out what's going on. I see this place called Carolina Functional Neurology Center, and I had seen some things about POTS, and I was like, I don't know, my symptoms kind of match POTS. I'm just going to go to this place, get an evaluation, see what they think. So I go and I do like a full eval with them, and they're like, you show some signs of dysautonomia, but not, you don't qualify as like a POTS diagnosis. Um, you could come in and do treatment with us, but I just don't know if it's going to move the needle for you. And I was like, okay, that's fine. Um, I decided not to make the investment because it didn't make sense to me at the time. Um, she did see in my blood work, though, that my iron levels were a little high, my serum iron, so like the iron in my blood, not my iron storage, which is my ferritin. And she's like, your ferritin's not where I want it to be, but your iron levels are high, so I want you to stop taking iron. So I just switched the prenatal. I was still taking a prenatal because I was still breastfeeding at this point. So I stopped taking the iron, and I do start taking a few supplements at her recommendation. Like I start taking vitamin D because it's low, and go on my merry way with just a couple benign supplements. Then I also decided I'm going to try acupuncture. This was recommended to me by the chiropractor I was seeing at the time because I was also in a chiropractor schedule on a regular basis, trying to see if that would help with my heart palpitations. And it did not. So she's like, okay, why don't you try my acupuncturist? Like, she does great things for me. See if you like her. So I do go, and man, acupuncture provided me relief that I hadn't seen in like a long time. That definitely helped even more with my anxiety, and I felt just very like relaxed and restored after every time I would go get acupuncture. So that brings me to January 2024. I continue going to acupuncture, and she's like, you know, things aren't progressing fully the way you want them to. I want to check a few of your labs. I'm, also in school for functional medicine. I'm not just a traditional Chinese medicine practitioner. Let's check your labs. So she tests my ferritin, and we find out that it's 5. The minimum that your ferritin should be at, according to my primary care, is 18, which anyone who knows a lot about like ferritin and how you're feeling will tell you like 50 should be the real floor, and you really want it closer to like 100. So I go back on iron. At that moment in time, I find this Facebook group called the Iron Protocol, which if your ferritin is low, you should definitely check it out. They pull in a lot of evidence from the American College of Hematology and help you get your ferritin back up. I immediately started to feel better as soon as I was taking iron. The exercise tolerance got better. The dizziness, lightheadedness, shortness of breath, all of those things started to get better. And I'm like, okay, cool, big win. It's just, I've got low ferritin. Like, I just need to take iron and then I'm going to feel better. Well, because I was feeling so good, and because I think I had an answer as to what was causing everything in my mind, I was like, I'm good. I'm coming off all my medications. And I did. I came off the pantoprazole and the sertraline, which were the 2 medications I was on at the time. And I was living a very normal life. I'm out running, I'm drinking alcohol, I have very little anxiety, I'm out of therapy. I'm just living life, feeling good, feeling great. Doing cold plunges, like just feel, feeling very robust, resilient, living a great life. Then in July, I get another bout of COVID, again, very mild. I did have COVID one other time throughout this journey, and I can't remember when it was, but this was like a super mild bout of COVID. I would never have even tested myself if I didn't know that people I was around had COVID. Then we get to September. I have a really high stress event. My boss gets fired. This may not sound like that big of a deal to most people, and probably a lot of people out there are like, oh, hell yeah, I would love if my boss got fired. Not me. I love my boss. She is still a really good friend of mine. She was very good about like seeing the value that I brought to the table. I had a lot of insecurities about like, will other people understand the value that I bring? She's just such an incredible person, incredible mentor. I learned so much from her. And just had an incredible time working with her. We had like a great team that loved each other. I was in like a golden, like I feel like we struck gold in my work situation, but unfortunately the company didn't feel like we struck gold in that work situation. So I was like, oh my God, what's going to happen to me? What's going to happen to this job? I feel also a lot of stress from it because my husband had quit his job earlier, or about a year ago at that point, but he had quit his job to stay home with the kids. And that meant all the income pressure is on me. And like, I just feel that pressure pretty acutely. So I was like, oh my God, if my boss is fired, what's going to happen to me? What's like, how am I going to make sure that I keep making the income that we need? Blah, blah, blah. I go very much into fight or flight. It's also a high stress event because then the right at the exact time my boss gets fired, I have to go to Seattle and be around a bunch of my coworkers who all know that my boss just got fired and I'm flying in from Charlotte to see them all. And I was like, oh my God, just in fight or flight the entire time that I'm there because it was just such like an intense emotional situation for me. So yeah, that was a little tough. And something weird did happen when I was in Seattle that time. I reflect on it now and I'm like, oh, this might have been why. I remember eating lunch and then sitting there and my heart was racing. I was like, that's so weird. Why is my heart racing? I don't know. Maybe it's just hot in here. Whatever. Um, Clue, later on, that ends up being explained by what I get diagnosed with. Um, I come back from Seattle, we retest my iron. It's coming back high again. So like the iron in my blood levels is coming back high and my saturation is coming back high, which basically means that there's so much iron in my body and there's not enough transporters to get the iron into storage or like the places it needs to go. So not great because then iron can deposit in places you don't want it. And I was like, okay, I'm gonna stop taking iron, just give my body a little reset, see what happens. My acupuncturist is like, your ferritin still didn't get anywhere close to where we want it to be. Let's just also check your colon. Let's get you a colonoscopy to see if you're like losing blood through your colon and that's why you're um, able to get like high iron in your blood, but then you're not able to get it into storage. So I get a colonoscopy, everything comes back clear. So that was lovely. But I get no answers from it. Then this is also another just like minor thing, but important to note. I ran the turkey trot and I barely pushed my pace, but I ran a little faster than I usually do, and I felt horrible the rest of the day. Like my heart rate just would not calm down. I did not feel recovered, and I was like, that's weird. Why do I feel that way? Hmm. Some early signs something was going down. So then in December, I take another trip to Seattle, this time to like meet with my new boss and one of my coworkers. We're doing some planning. Pretty quick trip, everything's good. But then I come back and like a week or two later, I'm out for a routine zone two jog and I feel shortness of breath on the jog. And then as soon as I finish, I come close to fainting. And I'm like, that's weird. I have like a really long bout of like pre-syncope. I actually don't know how to pronounce that. Um, but basically like that feeling like you're gonna faint. That feeling is the most miserable fucking feeling. I hate it so much. I have fainted before. It's usually around blood work. It's not from watching the needle. It's just like the blood gets drawn, the needle's in there for a little while, and then it's just like, boom, like I just crash. So I know the feeling well. I'm like, God, I feel like I'm gonna faint. What the hell? So I call the doctor and they're running through the line of questions. They're like, have you been on a long haul flight recently? I'm like, yeah, I went to Seattle a couple weeks ago. Does that count as a long haul flight? It's 6 hours from here. They're like, 6 hours is the cutoff of what we consider a long haul flight. So you do need to go to the emergency room. They need to rule out pulmonary embolism. So I'm like, fucking great. Cool. Go to the emergency room, have another bout of pre-syncope while I'm there. Horrible, long, so long. I was literally so unwell that I called my parents to say goodbye to them. I was like, I don't know what's happening to me right now. Like, it feels like I'm gonna faint, but it's lasting so long and it's so intense. I was just like, all right, I love you so much. Thanks for everything. And God, what a terrible call to get from your, like, what was I, 33, 32-year old child. 33? Yeah, 33 here. Anyway, I didn't pass out, but I felt like absolute dog shit. They basically tried to tell me I was probably having a panic attack. And I was like, it might have turned into a panic attack, but there's no reason I should be having a panic attack right now. Like, there's just no reason for it. Um, anyway, they find nothing. Classic. Once again, no one ever finds anything. And so they refer me to a cardiologist and say, you need to get more testing done. So I do that, but cardiology can't get me in until February. So in the meantime, I go back to therapy thinking, okay, if it's anxiety, I'm going to treat it. I also go back on pantoprazole because I threw up after a workout, thinking, okay, maybe like it's my stomach. So I was just trying different things that I could while I'm waiting for this test in February. But basically, I had to back off of everything. I was feeling horrible during the workday. My workouts were absolutely nothing. I was struggling to go for walks at this point, like long walks. So I'm wondering what's going to happen, just worrying every day that I'm basically dying and no one can help me out. But they get me in for a stress echocardiogram, which means I'm going to be on an exercise bike or treadmill, and they're going to put an ultrasound of my heart before, and then they're going to do an ultrasound of my heart after as well. And they're going to put all this monitoring on me to like watch my heart rhythm. I'm breathing into something, so they're watching my oxygen, all that fun stuff. So I do that. I call the test. I go on the treadmill and I'm like walking, and they keep turning the incline up, up, up. I call the test when my heart rate's in like the 120s. I start getting heart palpitations. Um, and I started to like feel a little icky, but not nearly as icky as I have some other times. I was just a little scared. They do the wand, and they look at me and they're like, everything looks fine. So then as I'm waiting to like go over those results with the doctor, the nurse pokes her head in and goes, we want to do the POTS test on her. And I'm like, here we go, POTS again. Okay. I'm sure I don't have this because I've already looked into this before. So they lay me down, take my blood pressure and heart rate, and then they stand me up and take it and watch it over time. And damned if it doesn't jump. So my heart rate jumped by more than 30 beats per minute. My blood pressure went all over the place trying to figure itself out. And they were like, there it is. It's POTS. That's what you have. And they're basically like, it's a physiology. It's not that there's something like structurally wrong or anything like that. You do not have a heart problem, but you do have a nervous system problem where your nervous system isn't sending the right signals to like get your blood vessels to constrict and send blood back to the heart. So you'll get blood pooling in your legs and in your hands, and your heart is going to beat really fast and sometimes really hard to try to make up for that because it's like, where is it? Where's the blood? Give me the blood. They're like, some people feel better in about 6 months. We don't really know. Some people don't feel better. It's a really shitty thing to have to live with. I'm so sorry. But here's some things that can help: compression, seeing a physical therapist, and moving to recumbent exercise, and having like a shit ton of electrolytes every day. And I'm like, okay, are you sure it's safe for me to be drinking all these electrolytes? And they're like, please drink at least two, if not three or more electrolytes a day. Like, and if it's hot, drink even more. And I'm like, okay, if you say so. And they want me to do the high salt ones. So here I am listening, building that blood volume. That's what I'm supposed to be doing. So they tell me to do those things. They also give me a Holter monitor to go home with to make sure I'm not having dangerous heart rhythms. They send me to do a vascular um, imaging. They want to make sure that I don't have any pelvic vein congestion. So I do that in a little bit. But I leave this appointment with like those orders. I'm like, okay, compression, physical therapy, and electrolytes, here I come. At this point, I stopped going to therapy because I don't really like, now that I have an answer and they're like, you're not dying. I'm like, okay, cool. I don't really need therapy anymore. Great. So then, yeah, it was in April that I got the pelvic vein congestion looked at, and I did show a small amount of pelvic vein congestion, but the solution for that, basically, like the cause of it first is actually, it can be pregnancy. Like it can just put pressure on veins in like your pelvic region, and there can be other things for it too, or it could just be genetic, whatever. But basically, then the blood is having a hard time getting back up through a main vein, artery, whatever. Clearly, I'm not a cardiologist, but one of the things, blood vessel, it struggles to like get back up through that, and it can make POTS symptoms worse. It can be a cause of POTS as well. But the solution for that is to put in a stent, and you would have to go on blood thinners. And then he's like, oh, you might also have to go on hormonal birth control because your blood thinners are, because you're on blood thinners. I'm like, okay, all this intervention for a maybe? Absolutely not. I'm just gonna try a lot of other things first to make sure I'm good. So then fast forward to June. I'm just doing all the things that they recommended, non-pharmacological intervention, because the high heart rate doesn't bother me enough to go on a beta blocker, which is pretty much all they can offer me as far as like symptom management. And I'm like, that ain't the symptom that's bothering me. So unless you got something that can make me tolerate exercise again, that can make me get through a work day without any brain fog, like you're not helping me out. So we get to June. I have a high stress event with my husband. He passes out on the floor, loses consciousness. And I have to call 911 because it was completely unexpected and he passed out a couple times in a row. And there were some signs that made me worried that it was potentially a seizure. So then I couldn't have him driving anywhere. Like I was just very freaked out. They sent him home from the emergency room and said he was fine, but I was just like, I need more clearance because what I saw was honestly fucking terrifying. And I was very stressed because I'm like, okay, I'm already unwell. I'm working and like doing the best I damn well can to work and make an income for the family. You're caring for the kids. You have to like drive the kids to school, do like care for them during the day. I'm already in such a precarious situation that if you're in a precarious situation, we're fucked. So I'm like on high alert because of this. Also at this time, I start having vision disturbances. So I'm like, you're seeing a neurologist. I'm going to go see a neurologist. First, I stopped at an ophthalmologist because that's what my cardiologist recommended. The ophthalmologist is like, your eyesight's great. Everything looks incredible. Like, I don't wear glasses. I don't have any blood vessel things. Like, I just have no eye issues that we know of. So she's like, you look good. I'm sending you to a neuro-ophthalmologist though, because if you think you're having vision disturbances, I just want someone to like look into that more. So I'm like, okay, I see a neuro-ophthalmologist. He finds vision issues. So I can pass like a peripheral vision test where they do like this and like how many fingers am I holding up, whatever, like that I can do. But then he put me on a machine where he wanted to check my peripheral vision. And like there was like these little lights that would flash, and I had to like hit a button every time I saw a light. And I remember looking at the woman after the test and I go, something's wrong, isn't it? Because I noticed I never hit the buzzer for anything down here. And she was like, you're just gonna have to talk to the neurologist. I was like, fuck. So the neurologist is like, yeah, you're missing vision down here. It's not complete vision loss, but there is vision loss here. So he's like, we need to image your brain because that means something happened there. Like, fucking great, cool. Um, I can't wait to get an MRI. I can't like wait a couple weeks after you tell me something like that. I'm like, did I have a stroke? What happened? Do I have MS? What's going on? I remember like vividly thinking I had MS at this time. So I go the next day to the emergency room to get an MRI. Fun. Took forever, paid a butt ton of money, but I got the MRI and I got the results, so I was driving myself less crazy. Kind of, because the results are that one, I do have a piece of brain matter missing where like it's in my occipital region, which would be why I'm missing vision right here. No idea why, no idea when. We're just going to assume it's a super old injury. I'm going to go with the story that it happened when I was like being delivered because I do have some vision there, which means my brain was like very plastic when it happened because it recovered some small amount of vision, even if it's not like as clear as it is over here. Like I can see something here, whereas I should not be able to see anything at all. So that's what I'm telling myself that I've just had it for life. So they find that, and then they're also like, "Oh, and you have like a cool, fun brain tumor." Awesome. Was definitely not expecting that result. And that is on your right hippocampus. It is on your memory center. And specifically, when we see brain tumors in that area, they are highly associated with intractable epilepsy, which means you have seizures and you cannot control seizures through medication. You have to get the tumor removed. So I'm like, okay, cool. Am I looking at brain surgery? Great. So I'm like freaking the hell out about all this stuff, even though they're like, it's not a cancerous growth. I'm like, okay, cool. So I don't have brain cancer, but I still have a brain tumor, and I still want to know like why and what's going to happen, whatever. So I come home from those results, and a couple days later, or the day after, a tree falls on my house. Doing a like more than $20,000 worth of damage. I want to say it was close to $40,000 worth of damage. And like obviously insurance covers that, but like still a pain in the ass to go through. And my body was on extremely high alert because I thought it fell on Arya's room. And I was like about to throw up going up the stairs, thinking that I was going to walk in and see like my child injured by a tree that fell on our house, a huge tree. It was my neighbor's tree. It was dead. It was very dead. I had seen that it was dead. Apparently, if you like you're supposed to tell your neighbor that their tree is dead. Why would I have to tell my neighbor that my tree is dead? They can see that the tree is dead. Whatever. Anyway, it's a whole thing with insurance. Like we had to pay our deductible. They're looking into it. I don't know. All this to say, the tree falling on the house was just an additional stressor. June 2025 was like the month from all fucking hell. So because I was going through all of that craziness, we decided like, okay, it's time for me to get back in therapy. I find a chronic illness therapist. I'm like, okay, this will be good. I took a little time off from work, and by a little time, I took like 2 weeks and a day. But hey, it was something. It just gave me a little space to deal with this stuff. Um, Also, this didn't happen this month, but it's not later in the presentation, so I'll just share. Everything ended up being completely fine with Colin. He has like vagal syncope was what they said. It was just like a freak accident that he fainted, and it's not something that I need to worry about. So ultimately, things were fine, and like my home is fixed now. The tree's all cleared up. That's good. But like the month from fucking hell, if I have ever seen a month from fucking hell. Which brings me to July. I need to start investigating these brain tumor results. So they want to do a repeat MRI to get closer imaging of the tumor itself. They want me to see a Duke epileptologist because of the just high, high, high prevalence of epilepsy with these types of tumor. And because I had been describing like the vision disturbances, and even to the point where sometimes I would feel like I would like black out for the splittest of split seconds, or I would like lose the communication channel between my brain and the rest of my body. And they're like, I don't know, maybe that's a seizure. Okay, cool. Great. Love it. So I'm going and seeing a epileptologist. He also refers me to oncology based on the repeat MRI because he's like, hey, it's probably not cancerous, this growth, but you do need to see a brain tumor specialist. They're in our oncology department. So I have to go to Duke to see an epileptologist and walk into Duke's Cancer Center to see a brain tumor, um, like a neurologist that specializes in brain tumors. Great, cool. Not the hardest thing I've ever done walking into that building, I'll tell you what. It was horrible. So I have a brain surgery consult to try and figure out like, do we need to remove this thing? What's going on? And I spend a lot of time being like, I probably have to get this thing removed. Like, how will I ever live with the fact that I have a brain tumor? Um, let's just remove this and then I won't have to worry about it. Well, if brain surgery goes a little wrong, I could lose memory. I could have memory problems. Also, not ideal. So I go with this brain surgery consult thinking like, okay, maybe I'm going to do this, maybe I'm not. But like, I was like, okay, if they offer it to me, I'm probably going to do it. They were ultimately like, the big things we need to nail down are like, are you having seizures? And is this thing cancerous? Because those would be the things that would make us need to pull this out. He also told me at the time, like, maybe it's a cavernous malformation because I have the vision loss in the one spot and then I have the tumor in another spot. He's like, maybe it's not actually a tumor. It's maybe like a blood vessel that like mulberried. And I don't know. Like basically, they're like, we don't know what it is, but the big things are if it's cancerous, we pull it out. If you're having seizures and you want it pulled out, we'll pull it out. Like, okay, a lot to think about, but we'll just wait on the next imaging at this point. Then I go to Carolina Functional Neurology, or like this is all kind of in the same timeline, but I go back to Carolina Functional Neurology Center and I'm like, okay, I know now that I have POTS. I've been trying to manage it and treat it on my own, and I've spent so much time, so much energy, so much money, and just so much like wasted life. I'm ready to go to someone who's an expert in POTS and see what they have to say. So I do. They run testing for me, and we're basically like, here's what we recommend, here's what we want to do. Then fast forward to, I just got the baby monitor from my husband. So if I don't edit that out, that is why I just lost all train of thought. Okay. So Carolina Functional Neurology like recommends a course of action for me, and I'm basically like, okay, I'm gonna figure this out, but we need to we just need to like reshuffle some things because it's a big time commitment, big cost commitment. And again, it's all a maybe. So I do agree to start seeing them once we figure out that I don't necessarily need like brain surgery at a certain point. There was also a brief bout within there where I like tried anti-seizure medications just to see if I was having seizures because we had done multiple EEGs and they all came back that I wasn't having seizures. But we were like, I still feel funky. Maybe we just try this medication, see if you're having seizures. No, no, no. That medication went so poorly that I was off it within 3 days and never looked back. So still a lot of like unknowns and up in the air. I'm like, okay, I'm gonna start seeing Carolina Functional Neurology. I'm gonna try to stop worrying about the brain tumor for now because they're not super worried about the brain tumor. I don't have a follow-up for a few months. Okay, cool. Um, so then we're into like the September to November timeframe. I go on a couple more ER trips for weird random things, one of them being vision related. So when I went for having like more vision disturbances that were just unexplained, they did more imaging of my brain. They did a CT scan this time. I'm thinking to myself, what is the point of doing a CT scan? We have already done multiple MRIs. We know what's in my brain. And I was like, hey man, why are you doing this imaging? Is it going to tell you if I'm having a stroke or not? He's like, oh no, this wouldn't tell us if you're having a stroke. And I'm like, okay, I don't know why you did it, but whatever. It ended up being a blessing that he did it because when they did that CT scan, it showed that my tumor is extremely calcified. And that just means to me, it has been there for a long time. Like when I had someone look at it, they're like, oh yeah, this is not new. There's no way that this tumor just popped up in June when you were having vision disturbances. You've had this for a really long time. So I was like, okay, probably not the cause of my issues. Um, so I kind of put the brain tumor to bed. I put it to rest in my mind for a little while. And I'm like, I'm just going to focus on POTS here. I start seeing a somatic therapist at the recommendation of Carolina Functional Neurology because they basically said to me, we're doing a lot of therapy and treatment with you. You've done a lot of therapy and treatment yourself, but I don't think that your body is in a place where it's receptive to the treatment that it's getting because you're just like wound so tightly. And I was. I mean, I like to say I haven't unclenched since I was 12. I'm just very, that's just kind of how I am as a person. And I needed to like relax and let my body like actually start to absorb and like utilize, integrate some of the therapies that I was getting. So I started seeing a somatic therapist. Long story short, that woman has changed my life. She is so incredible. I'm hoping to have her on the podcast to talk about what it is that we do together because I have never seen the like decrease in anxiety from all of the different therapies. Like I had on here multiple different therapists throughout my journey. I think I've had 5 therapists in the last 5 years. This one, and then like they all had like great qualities to them, but like what I do with Chelsea is incredible and like has made so much more of a difference than when I ever see like had done cognitive behavioral therapy. So I start doing that. I'm getting more and more treatments at Carolina Functional Neurology Center, and I'm starting to see progress, but it kind of waffles back and forth. And finally, I'm like, something that's really like, I really feel like my issues are tied to my stomach. I don't know why, but I can tell you every time I am bothered, my stomach is part of it. Every time I'm feeling like super symptomatic, that area of my body is acting funny. So my uh, functional neurologist at Carolina Functional Neurology was like, why don't we do an elimination diet with you? So I was like, okay, you know what? I'm just going to start by eliminating gluten and dairy because it's the holidays. I'm not doing a full elimination diet, but I'll eliminate the two biggest offenders. And holy shit, did it help. Man, my brain fog went away within a couple weeks. Crazy. I started feeling like significantly better. Between that and then the work that I'm doing with Chelsea allowing me to actually absorb the therapies that I'm getting, I am feeling like a lot better now. Now we're getting into December 2025, and I'm truly starting to like, wow, see a light at the end of the tunnel after the year from absolute hell, feeling like shit for a complete year. I'm like, oh, I'm finally starting to feel a little bit better. I'm finally starting to get some relief here. I'm still symptomatic. I definitely still have symptoms, but I'm able to make it through the work days. I don't have to pace so aggressively. I'm not like looking forward to laying down at all moments of the day. I'm not like constantly holding my head in my hands. And I can start doing things again. I'm driving up to 20 minutes at a time. I had stopped driving back when I found the brain tumor because one, it had already been hard for me with POTS. And then two, I was like, I might have a seizure at any moment. I'm not driving. So I had to journey back into driving. Um, I am starting to do jog walk sequences now. So I was, unable to run. My cardio workouts have been horrible. They're so stupid. If I'm being honest, like I can barely get my heart rate up and I'm like, okay, this is all I can do. Great. So now I'm doing jog walk sequences, which is not the running that I want to be doing, but hey, progress, baby, and I will take it. I'm using a barbell again. I'm like working out upright and like I'm feeling some of my freedom coming back. So that has been huge. And that just brings me to where we are today, which is like, do I have a perfect answer as to why this happened to me? Do I have a perfect solution as to what I'm going to do to get better? No. There's not like a huge silver bullet. There's not a very clear this is why it happened and this is what you do to resolve it. But I have some answers that have gotten me closer. I think like the why I would have to say is probably a big combination of things. I have gone very deep into the world of chronic illness, which is a world I did not even know existed until I became a part of it. Um, and there's a lot out there about how your nervous system, like, has to be in a state to, like, in a bad state, essentially, to take on a chronic illness. Um, so it's like stored trauma, like just unresolved trauma tends to be a thing. Infections tend to be a thing. Um, like mold is a big thing. So there's a lot of different things that can be contributing factors. And it turns out I basically have a lot of them. So I definitely can reflect on some significant traumas from when I was in middle school and high school that I don't know if I ever fully resolved. I've definitely had the like people pleaser, high achiever, like archetypes, whatever. Like I act in those ways. I'm very much a people pleaser. I'm very much a high achiever. So I'm in a constant state of like, eat, like I said, and just suppressing what I need for, whatever's going to please everyone else. So that's probably a part of it that plays into it. It puts me in a specific state where my body accepts, you know, illness a little bit better. I was a kid that was like sick often. I did have chronic sinus infections, not chronic, but I had like recurring sinus infections. I had pneumonia. I had mono a couple times. Like, um, lots of like fun things went on in that regard. So I'm like, okay, I was always a little bit more prone to getting sick. Um, I've had multiple COVID infections. I've had the flu multiple times. All of these things can be triggers. The COVID vaccine can be a trigger. Mold can be a trigger. And I literally have all of these things. We did a mold test for me in December that came back. I do have one specific kind of mold. So now I have to try and get that out. But thank God we didn't find it until now because if I had tried to detox it earlier than this, I probably would have been not handling it well because my body was in already such a fragile state. So I'm really hoping that now I can handle a mold detox. All this to say, I think of it as like a perfect storm. It was like stored trauma, viral infections, vaccines. Um, now, and I am not saying all vaccines are bad, and I am not saying you should not get vaccinated. I'm just not that kind of person. But I am saying I think I had a negative reaction to the COVID vaccine, and I think I'm one of the people that did. And I think it was not just the COVID vaccine; it is the culmination of all of these things in conjunction with the COVID vaccine that brought me to this place. COVID itself, like I said, I still test positive for Epstein-Barr virus, and I'm not talking about like just like antibodies. I show active infection of Epstein-Barr virus, so that's like the mono is reactivated in my body, so I have probably like high viral load in general. Like I said, I have the mold. Um, I think some of these things have contributed to weaker connective tissue in my neck because I have like serious neck tightness and neck stability issues that I'm working on in physical therapy. And those can specifically, like the degradation of your connective tissue in the neck can be an issue that comes from mold and chronic infections and like the spike protein and whatnot. And when your neck is unstable, it can cause issues with your vagus nerve, which can cause dysautonomia and POTS. So it's not one thing for me, which is why it has not been one thing that has made me feel better, but it really a culmination of all these things. And I'm just hoping, praying, believing that I will come out truly on the other side of this, having learned so much and not have to go through this kind of thing and help other people to not have to go through this kind of thing either. I never wanted to be the poster child for chronic illness. I never wanted to be the one to have to inform people, but here I am. I'm going to use it. I'm going to do it to the best of my ability. So that is my health story up until this point. Um, it's still ongoing, and you'll get updates along the way as I continue to try new therapies and feel better. I still have things on the list that I want to try if I don't get to a better place. Um, and I do not want this to be one of those endless journeys where I'm just like always healing. Like, no, 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 no. I want to, I want to be able to like wrap this with a bow and live my goddamn life. But I do know that I will need to like take care of myself in specific ways because of the sensitivities and something like this happening. So, if you made it through all of that, cheers. And if you have any questions, thoughts, concerns, comments, let me know. I would very much love to address them. And thank you for being here. I'll see you in our next episode of the Stoddscast.